The COVID-19 pandemic has disrupted daily routines. For kids, it's online learning and fewer extracurriculars. These lifestyle changes could have led to more cases of childhood obesity. Now, health experts say if obese kids get COVID-19, they could feel more of an effect.
We know COVID is a problem in the obese adult. It's clearly a problem in obese children.
Dr. James Grant is the chief medical officer at Blue Cross Blue Shield of Michigan. He says obesity in general isn't good for you, but if an overweight kid were to get COVID-19,
their fevers are going to be a little worse. Their coughing is going to be a little worse. Their response to COVID, their healing from COVID, the amount of time it takes them to get better is actually going to get worse in obese children.
Dr. Grant says when a kid is carrying extra weight, their bodies experience more inflammation fighting off regular infections.
An obese child that gets COVID, they could actually have much worse effects than an adult that gets COVID.
The number one risk factor for a poor outcome with COVID in a pediatric population in kids is being overweight.
Dr. Cortland Katayan, the Vice President for Population Health at Henry Ford Allegiance in Jackson, says the respiratory issues with COVID are of extra concern.
If it's harder to take a deep breath because you have additional weight pushing on you, it's going to be, you're going to struggle more when you have a lung infection.
Dr. Katayan and Dr. Grant say one of the best ways to improve immunity in kids is to make healthier choices.
How about some fruits and vegetables? Not necessarily, chips and cupcakes and ice cream.
It's really important that parents are modeling behavior they want to see in their children growing up, both with their diet and also their exercise habits.
These health experts also suggest kids should increase their physical activity. They also recommend if your child is 5 and up, they should get vaccinated to protect them from COVID-19. In the studio, Samana Sheikh, 6 News.